Welcome to Knowledge Park. Why does our body need sugar? It's our basic fuel. What if a simple diagnosis wasn't a life sentence, but a wake-up call? Millions are living with diabetes and prediabetes, often without knowing the full story. Diabetes is a breakdown in the body's fuel delivery system, an insulin problem. Think of insulin as a key that unlocks your body's cells to let sugar in for energy. Insulin is the key. With resistance, locks barely open, leaving glucose in the blood. Over time, high sugars can harm blood vessels, nerves, kidneys, and eyes. In diabetes, either the key factory shuts down, that's type 1, or the locks get rusty and the keys stop working, that's type 2. The result? Sugar builds up in your blood. Your pancreas has two jobs. Exocrine cells make digestive juices for the gut, and endocrine islets make hormones that control blood sugar. Exocrine acinar cells send enzymes through tiny ducts into the small intestine to help digest fat, protein, and carbs. Endocrine islets of Langerhans act like a control center. Beta cells release insulin, the brake pedal, to lower glucose after meals. Alpha cells release glucagon, the gas pedal, when sugar is low to free liver glucose. Delta cells release somatostatin, the regulator, modulating both alpha and beta. Think of a smart kitchen. Beta cell chefs make insulin keys after meals. Alpha cell emergency staff release stored snacks from the liver pantry when you're hungry. They must work in harmony to keep energy steady. In the pancreas, beta cells make insulin. They build it from a starter protein, pack it into tiny storage bags, and keep it ready. When blood sugar rises, those bags open. Insulin comes out in two waves. First, a quick burst to catch the spike, then a steady flow to hold levels steady. It travels first to the liver, which acts as the body's main sugar buffer, smoothing highs after meals. Meet the dark horse. Incretins, GLP-1 and GIP, gut hormones released when you eat. They boost insulin from beta cells, tell alpha cells to ease glucagon, and slow stomach emptying so you feel fuller longer. Analogy: incretins are the site foreman. When food arrives, the foreman pushes beta cells to work faster and tells alpha cells to take a break. In type 2, this incret in effect is weaker. We'll focus on lifestyle strategies and tests, not medications. Know the numbers. Normal, fasting under 100 milligrams per deciliter, A1C under 5.7%, and 2-hour test under 140. Pre-diabetes, fasting 100 to 125, A1C 5.7 to 6.4, or 2-hour 140 to 199. Diabetes, fasting 126 or higher, A1C 6.5 or higher, or 2-hour 200 or higher. Confirm results with your clinician. HbA1c reflects your average glucose over about 3 months. Think sugar coating on red blood cells. Higher coating means higher long-term exposure and greater risk of complications. Fasting insulin and C-peptide show how much insulin your body still makes. Low or absent values suggest type 1 or late burnout. Normal or high values with high glucose suggest insulin resistance in type 2. The OGTT is a stress test for your whole glucose system. After a measured glucose drink, time checks reveal how quickly insulin rises and glucose returns to normal, uncovering early dysfunction missed by fasting tests. Screening matters. If you have risk factors, get an A1C or fasting plasma glucose yearly, or sooner if you notice symptoms. With prediabetes, recheck at least once a year. Keep routine vaccines current to reduce complications. Type 1 is an autoimmune condition, often starting in youth. Type 2, which is far more common, is linked to lifestyle and genetics. You already heard the prediabetes ranges. If you're in that warning zone, focus on whole foods, take a walk after meals, work toward gradual weight loss, and schedule regular follow-ups for coaching. Discuss a personal plan with your clinician. Catch it early. Reverse the trend. In type 2 diabetes, chronic high glucose harms beta cells, called glucotox E Ct. Over time, damaged beta cells release less insulin, worsening sugars. Imagine a factory. Due to rusty locks, insulin resistance, the beta cell workers pull double shifts. Years of overwork lead to burnout and some quit. That is beta cell exhaustion. That's why type 2 can progress. Early aggressive management, food, activity, weight loss, and medicines can rest beta cells and slow decline. Plan this with your clinician. This is your body's yellow alert. The powerful news? Prediabetes can often be reversed. Lifestyle changes are the foundation. Food, movement, sleep, stress care, and support. For any treatment decisions, talk with your clinician. Don't ignore the signs. Extreme thirst, frequent urination, unexplained fatigue, blurry vision, and slow healing cuts. But here's the danger. Many people, especially with prediabetes or early type 2, have no symptoms at all. Kidney checkpoint. Below about 180 milligrams per deciliter, the nephron reabsorbs nearly all filtered glucose. That limit is the REE-annual threshold for glucose. When blood sugar rises above that threshold, the tubules cannot keep up. Glucose spills into urine and pulls water with it, causing frequent urination and thirst. Analogy: the kidney is a coffee filter. With a sugar flood, the filter is overwhelmed and sugar leaks into the coffee, the urine. When blood sugar rises above the kidney's threshold, some glucose can appear in urine. That's part of why thirst and frequent urination happen. Work with your clinician on safe, personalized care. That's why knowing your risk factors, like family history, being overweight, or a poor diet, is so important. The single most powerful tool you have is on your plate. You don't need a special diabetic diet, just a smart one. Follow the plate method. Half non-starchy vegetables, a quarter lean protein, a quarter complex carbs. Load up on fiber-rich foods and ditch the sugary drinks and processed carbs. Nutrition targets that help. Aim for 25 to 35 grams of fiber daily. Most meals include 30 to 60 grams of carbohydrate, individualized with your care team. Choose whole foods, read labels, and pair carbs with protein or healthy fat. Hydrate and skip sugary drinks. Red light foods spike glucose. Sugary drinks, sweets, refined grains, and deep-fried items. Keep them rare or in small portions. Pro tip: try eating your veggies and protein before your carbs. It can significantly lower your blood sugar spike. Think of diabetes care like a chair with 4 legs: food choices, activity, medicines and technology, and support, sleep, stress, and routines. Keep all legs strong for stability. Choose whole, minimally processed foods. Favor low GI options. Cook with healthy fats like olive, mustard, or groundnut oil, and avoid trans fats. Move your body. Aim for 150 minutes of moderate activity per week, like brisk walking or cycling. Add strength training twice a week. Muscle is a sugar-burning machine. Strength training builds muscle, which stores glucose better and boosts insulin sensitivity. 2 to 3 sessions weekly is ideal. And don't forget the unsung heroes: quality sleep and stress management. Chronic stress raises cortisol, increasing blood sugar and insulin resistance. Sleep loss raises insulin resistance and hunger hormones. Aim for 7 to 9 hours and keep a regular schedule. Poor sleep or sleep apnea increases ghrelin, lowers leptin, and raises cortisol, driving hunger and insulin resistance. A simple 10-minute walk after a meal or a daily meditation session can work wonders for your blood sugar. Track progress with time and range if you use a CGM. Many adults aim for at least 70% of readings between 70 and 180 milligrams per deciliter, while avoiding lows under 70. Personalize goals with your team. Technology is revolutionizing diabetes care. Continuous glucose monitors give real-time data without finger pricks, and insulin pumps deliver precise doses. The future is even brighter, with research into smart insulins and artificial pancreas systems. There has never been more hope. Build routines, weekly meal plan, step targets, medication reminders, and scheduled check-ins with your care team. This journey isn't just physical. Your mental health matters. Lean on your family, join a support group, and talk to your doctor. Build a healthcare team. For diabetes, consult the endocrinology or diabetes department. Start with your primary care doctor for referral. Also see a dietitian or certified diabetes educator, plus eye and foot specialists. Remember, this is a condition you manage, not a life sentence. With the right knowledge and support, people with diabetes live full, powerful, and healthy lives. Progress over perfection. Small, consistent habits beat short, intense fixes. You are not alone. With knowledge and support, keep going forward. Get screened, know your numbers, and be the CEO of your health. Bonus essentials: lows, shaking, sweating, confusion. Treat with 15 grams fast carbs, then recheck in 15. Sick day: hydrate, check sugars more often. If type 1, check ketones and never stop insulin. Call your clinician if vomiting or ketones stay high. ABCDE care: A, A1C, B, blood pressure, C, cholesterol, D, drugs and diabetes education, E, eye and foot exams. Then A1C every 3 months until stable, annual dilated eye exam, daily foot checks, yearly urine albumin and kidney function, and regular blood pressure and lipids. Build reminders into your calendar. Mark follow-ups on your calendar. Consistency prevents complications and keeps goals on track. Remission is possible for some. Sustained weight loss, smart eating, activity, and medical support can normalize A1C without medicines. Always plan this with your clinician. Daily foot care: check soles, wash and dry, moisturize, not between toes, never walk barefoot, and seek care fast for sores or numbness. Picture a rusty lock. On your cell surface is a lock, waiting for the insulin key. Insulin clicks into the lock switches on. A relay starts, green lights pass the signal along. Insulin, the key. The lock, your cell's receptor. The lock on the cell. First relay runner, an inside messenger. Next runners carry the signal forward. The message tells glucose carriers to get ready. They move to the cell surface. Doors open. Glucose flows in for energy. Inflammation signals can jam the relay. More inflammation adds noise to the signal. Excess free fatty acids also interfere. When that happens, doors stay inside and glucose stays out. Left. Smooth relay. GLUT4 at the surface. Right. Blocked relay. Doors stay closed. The liver may release too much sugar. Muscles take in too little sugar. The pancreas works harder. What helps the relay? Daily movement, especially after meals, makes muscles hungrier for glucose. Small, steady habits keep the relay smooth. Add gentle movement after meals. Even 10 minutes helps. Sleep well and manage stress. Both improve those tiny handoffs inside cells. Fiber feeds gut microbes. They produce short-chain fats like butyrate, signals that support sensitivity. A consistent daytime eating window can give insulin signaling a rest. For example, some choose noon to 8 p.m., only with your clinician's guidance. Technology can help you notice patterns. Work with your clinician to personalize goals. Deep belly fat acts like a slow drip of inflammation. Gradual fat loss reduces that noise. That gunk clogs the locks. For treatments or changes, partner with your clinician. Insulin resistance is a fixable relay. Small, steady habits improve the handoffs. Smart apps read CGM data to spot lows early. They give coaching in real time. Technology can support you, but your clinician guides the plan. Keep going, progress over perfection. Improve the handoffs, one small habit at a time. Pair smart science with daily routines and professional guidance. Thanks for watching. If this helped, please like, subscribe, and share.